Every day, millions of Americans pour themselves a glass of water without even thinking twice about it. We trust that it's clean and safe and free from harm. But what if that water looks crystal clear and it's not as clean as you think it is? Across the country, a class of man-made chemicals known as Pfas, or per-polyfluoroalkyl substances, has quietly seeped its way into our environment and our bodies. Scientists call them forever chemicals because once they're released, they don't easily break down. They stay in our water, our soil, and even our bloodstreams, creating a growing public health concern that affects communities in every single state. PFAS have been around since the 1940s, used to make everyday items like non-stick cookingware, stain-resistant fabric, fast food wrappers, and even firefighting foam. They've been praised for their convenience, but that convenience comes at a hefty cost. When factories produce or dispose of PFAS, those forever chemicals, can seep into the groundwater, nearby rivers. Even firefighting training sites where foam is sprayed repeatedly can leave behind significant contamination. Over time, these chemicals travel through the environment and end up in municipal water systems and private wells. For most people, the primary source of exposure isn't a factory. It's the very water that we drink from, our kitchen sinks. Reducing PFAS exposure begins with two things: awareness and small yet consistent actions. On an individual level, families can install home filtration systems, as you see to the right, especially those certified in removing PFAS. Choosing cookware and household items labeled PFAS-free and properly disposing chemical products can also make a big difference. At the community level, prevention requires accountability and investments. Water utilities can upgrade their systems using technologies such as activated carbon or reverse osmosis to capture these chemicals before they reach the faucet. Cities and states can demand that their companies disclose PFAS use and participate in their efforts to cleaning them up. The key message here is to reduce and prevent as much of possible exposure as possible. We can all do our part, citizens, industries, and local leaders, to make a big difference in this effort. Protecting our drinking water involves several key agencies, each with their distinctive role. The U.S. Environmental Protection Agency, or EPA, is responsible for setting and enforcing national drinking water standards under the Safe Drinking Water Act. They evaluate new data, monitor compliance, and establish limits for harmful contaminants such as, well, you guessed it, PFAS. The CDC, or the Center for Disease Control, works very closely with the agency known as Toxic Substance and Disease Registry to research health impacts and guide public health responses. Here in Arizona, the Department of Environmental Quality, or ADEQ, oversees state-level testing and works with counties to track contamination. Local health departments make sure residents are informed, coordinate testing programs, and help implement cleanup plans. All together, these agencies form a network that keep the public informed and protected. In 2024, the EPA announced the first to protect the public health. The Arizona Department of Environmental Quality began statewide testing to identify water systems affected by PFAS. The results? They show that most systems are meeting the new EPA standards. About 88% of Arizona's public water systems are in full compliance. However, 12% exceeded at least one PFAS limit, meaning the water in those areas may pose a greater long-term risk if they're not addressed soon. The highest rates of exceedance were found in Santa Cruz County at 44%, followed by Gila at 29%, and then at Pima at 17%. These findings help state prioritize cleaning efforts and funding, ensuring that every community, large or small, has access to safe and clean drinking water. As you can see in this chart shown, both small and large water systems are being monitored closely, with ongoing testing and mitigation already underway. Water is something that we all share. It connects our neighborhoods, our cities, and our future. Addressing PFAS contamination isn't just an environmental issue, it is a public health priority and a moral obligation. By learning more, staying informed, and supporting stronger environmental protections, we can make sure that every community, no matter the size of the zip code, has access to clean and safe water. Together we can turn awareness into action, policy into protection, and concern into change. Because this isn't just about chemicals, it's about people like you and me and the water that we all depend on.